Hello, may I come in?
Yes.
Hello, Mr. Leon again. My name is Antonio and I'm your nurse with Tarrant County College. Today we're going to be performing a cardiovascular, and we're also going to be checking for your respiratory, okay?
Okay.
Before I do anything, I'm going to perform hand hygiene, and then I'm going to go ahead and start by inspecting my patient. So the first thing that I'm going to be looking is for the symmetry of the chest and his torso, and I see that it looks symmetrical. I don't see any barrel chest or any signs of the sort. Then I'm going to go ahead and inspect my patient's back. So if you could turn over a little bit to this side. I also see that his back part is also symmetrical, and there's no signs of any lesions or anything. I'm going to be palpating. Please let me know if you feel any tenderness. Do you feel any tenderness?
No. No.
All right, no tenderness reported by the patient. And I'm going to be doing the same in the front. Let me know if you feel any tenderness.
No.
No? There's no masses. There's no lesions. All right, everything looks good. So now I'm going to go ahead and move on to the next part of the assessment, which will be to, I'm going to hold the patient's chest this way, and I'm going to have the patient take a deep breath for me. Good, and I'm looking for that expansion of the chest. Make sure that it's symmetrical. Can you do that again for me? Good. Now I'm going to go ahead and do the same thing in the back. I'm going to put my hands around his back, and I'm going to have this patient take a deep breath. One more time. All right, and that was good. That was symmetrical on both sides. I was looking for his lung expansion, and that was pretty good. So now I'm going to go ahead and I'm going to do the tactile parameters test. I'm going to, if you could turn around for me again one more time, please.
Which way?
This way, sir. And push back for me. Okay. So now I'm going to press, and I want you to say 99.
99. 99. 99. 99. 99.
Good.
99. 99. 99. 99.
Good. All right. Now we're going to do the same with the front.
99. 99. 99. 99. 99. 99.
All right, now we're going to go ahead and we're going to auscultate for the lung sounds of the anterior part of the chest. We're going to start up here. Deep breath. Deep breath. In through your mouth, out through your mouth. Good. One deep breath. One more. One more. One more. Last one. And one more. All right, and I did not hear any crackling, any wheezing, or any abnormal lung sounds. So now we're going to go ahead and check the posterior side of the chest. If you could turn around for me, please. All the way over. Just push your leg over and around. All right, and this is going to be the same thing. In through your mouth, out through your mouth. Deep breath. Okay, one more. Okay. Big breath. Big breath. Big breath. Big breath. One more. All right, and I also did not hear any abnormal signs on his posterior chest. Lung sounds good, no crackles, no wheezing. Welcome back. Now we're going to move forward with the cardiovascular test, and we're going to start by checking the pulses, and we're going to do it from head to toe. So are we going to start with the temporal pulse from the head, and we're going to go ahead and that should be around this area right here. We're going to check them bilaterally, and we're going to compare those pulses. All right, those pulses are 2+. They feel very good. Now we're going to go ahead and look for the facial artery, and we're going to go down here. So you're going to check those bilaterally. All right, and those pulses feel good as well, 2 plus. Now we're gonna move down to the carotid artery. That one we cannot check bilaterally, so we're gonna have to do one at a time. So I'm going to start with the left side of the patient. Okay, good, that one is 2 plus, and we're gonna look for the other side. Very good, very strong pulse, 2 plus as well. Alright, so now that we checked for the pulses of the head, we're gonna move on and we're gonna check the chest area. We're gonna listen for some heart sounds, okay? Alright, and for this part of the test, you can just breathe normally. Listen to the Erb's point. And now we're going to go ahead and listen to the apex of the heart. Alright, his heart sounds very good, pretty normal. We're going to go ahead and listen with the bell of the stethoscope, and we're going to be looking for any signs of murmurs. All right, and I did not detect any sounds of murmurs. So this part of the assessment, we're going to be checking for capillary refill. This should be less than 2 seconds on a normal person. So we're gonna go ahead and start with the upper extremity, which is his hands. And we'll start with the right hand. And we're just making sure that his capillary refill is good. Okay, perfect, that one was good. All right, capillary refill in his upper extremities are good. Now we're gonna move forward to the bottom extremity. I'm gonna start with the right foot. All right, we're gonna move forward to the left. All right, and capillary refill from the lower extremities is also less than 2 seconds. Right, so since we have the patient in this position, we're just gonna move forward and check for his lower extremities pulses. The first one that we have will be the femoral pulse, which is all the way in the groin area. We're not gonna be assessing that one today. But we could go ahead and check for the popliteal pulse, which is behind the knees. This one is a little deep and a little hard to find sometimes, so please bear with me. We're going to be checking those bilaterally. Okay. All right, and those feel pretty normal. They're 2 plus. Now we're gonna move downward and we're gonna look for the posterior tibial pulse, which is back here, this area. And I'm gonna try to do those bilaterally. All right, and those are also 2 plus. And now if you could just, for the purpose of demonstration, I'm going to place your foot up here and we're going to look for the one in the dorsalis pelvis. If you could please raise up your, there we go. And this should be somewhere around here. All right, that one feels good, it's 2 plus as well. We're gonna check this one since you're over here already. All right, and that pulse is also 2 plus. So now that we're here, we're going to be assessing the pulses and the upper extremities, specifically the arms. So the first one that we're going to be assessing is the brachial pulse. This one is pretty easy to find. All right, and those are pretty strong, 2 plus on both sides. Now we're going to be looking for the radial pulse, and that one is also pretty common and easy to find. This is where most people take the pulse for patients. And those are also pretty strong, and they're 2+. All right, so now part of our assessment is to check for the patient's apical pulse for 1 full minute. So that's what we're going to do. All right, and patient's apical pulse is 72, which is within normal limits.